In this video, I am going to discuss one interesting case. A 42-year-old man presented to hospital with history of fever and headache for the last 2 days. There was no associated complaint of cold, sore throat, myalgia, abdominal pain, loose motion, urinary symptoms, rash, or joint pain. There was no significant past medical history, no travel history, and no pets except cockatiel bird that he brought around 7 days back. On examination, he was febrile and temperature 38.5 degrees centigrade and the presence of hepatomegaly. Rest of the physical exam was normal. On the date of admission, his labs were total leukocyte count normal, lymphocytopenia, monocytosis, platelet count normal, CRP 107 mg per liter, procalcitonin 0.48 nanogram per ml, serum sodium 133 milliequivalent per liter, SGPT 69 unit per liter, SGOT 65 unit per liter. Serum bilirubin and creatinine normal, and ultrasound abdomen revealed the presence of hepatomegaly. On day 1 to day 3, his labs showed normal leukocyte and platelet count, persistence of lymphocytopenia and monocytosis, worsening liver enzymes with normal bilirubin, continuously rising CRP. The level peaked to 185 mg per liter, procalcitonin high and stable at around 0.50 nanogram per ml, normal creatinine. Malaria, enteric and dengue negative. Negative blood and urine culture. Negative hepatic viral serology and normal chest X-ray. Patient still febrile and unwell. What is the diagnosis? We suspected psittacosis. Sample for serology IgM Chlamydia psittaci sent, and he was started on doxycycline. Why we suspected psittacosis? There was history of exposure to bird recently which establishes epidemiological link. All cultures including blood and urine were negative. Common tropical infections were negative including malaria, enteric and dengue fever. The initial lab picture was consistent with this infection including normal white cell count, lymphocytopenia, high CRP, altered liver enzymes and hyponatremia. Elevated procalcitonin but not very high value suggests atypical bacterial infection. We discharged the patient on day 5 as he was afebrile and clinically feeling much better and CRP started reducing. He was continued on doxycycline for total 14 days. Chlamydia IgM report turned out to be negative. On follow-up, patient remained asymptomatic. We discharged the patient with likely diagnosis of psittacosis, as in addition to the reasons mentioned, he responded to doxycycline, strengthening our suspicion despite negative IgM report. There could be various reasons of negative chlamydia serology in this patient apart from another diagnosis, and they can be if the test was performed too early in the infection, antibiotic treatment, and inadequate immune response due to genetic variations in the host's immune system. Chlamydia psittaci infection is transmitted from infected birds, particularly parrots, but also other species like turkeys and pigeons. Fever, headache, chills, a dry cough, and muscle aches are common symptomatology. Infection is contracted by inhaling dust from dried bird droppings or handling infected birds. Incubation period is typically 5 to 14 days. It is hard to diagnose from body fluid samples. It is usually diagnosed based on symptoms and history of bird exposure. The investigation for this infection includes serology, microimmunofluorescence test. This test is considered the most sensitive and specific, a 4-fold increase in antibody titer between acute and convalescent blood samples, taken at least 2 weeks apart. Another test is nucleic acid amplification test using PCR method that detects Chlamydia psittaci DNA in specimens such as sputum, blood, or stool. Metagenomic next-generation sequencing is another test. It is an effective, rapid diagnostic tool. We did microimmunofluorescence test which requires repeat tests to look for 4-fold rise in titer. The common antibiotics against this organism include tetracycline, macrolides, and fluoroquinolones. Learning. If you encounter a patient with acute febrile illness and tropical infection is suspected, based on clinical and lab data, and results of common tropical infections turned out to be negative, it is prudent to start doxycycline empirically, as it covers many tropical infections which are not very common, and for whom diagnostics are either not easily available, takes time to get the results, or not highly specific and/or sensitive. Do you have any opinion on this case? Please send me as a comment.